2 months after President Donald Trump celebrated the signing of his so-called One Big Beautiful Bill at the White House, its impact is already being felt in some of the most vulnerable corners of America. In Virginia, a major healthcare provider has announced the closure of 3 rural clinics that served communities along the Blue Ridge Mountains. The company, Augusta Medical Group, explained that these closures were a direct response to the bill's new funding realities. Rural hospitals and clinics were already under heavy strain, relying heavily on Medicaid funding to survive. Now, with hundreds of billions of dollars in federal health spending set to be cut over the next decade, many fear that the situation will only get worse. Democrats across the country are connecting these struggles to Trump and Republican leadership as they campaign in upcoming elections. In Virginia, Democratic candidate Abigail Spanberger visited Buena Vista, a small town of about 6,600 people, where one of the clinics is shutting its doors. She, along with other Democratic leaders across Georgia, Iowa, New Mexico, and New York, has warned that these closures are only the tip of the iceberg. Republicans, however, are pushing back. Virginia GOP leaders argue that consolidating 2 clinics into stronger, more sustainable operations can actually improve patient access. They also point to a new $50 billion rural health fund created in the bill, which they claim represents the largest investment in rural hospitals in decades. Supporters say this fund, along with mobile clinics and reassignment of patients to nearby facilities, will help cushion the blow. But experts warn that the numbers don't add up. The Congressional Budget Office projects that Medicaid spending will shrink by more than $900 billion over 10 years. This means roughly 7.5 million more Americans could lose their health coverage by 2034, many of them in rural communities where jobs are scarce and work requirements are harder to meet. That's why health policy researchers believe that even with the $50 billion fund, providers may still be left struggling. For families, the closures are more than just numbers. Parents like Candace Crow, who relies on her local clinic for her 4 children with autism, say losing these services could be a matter of life and death. In emergencies, every minute counts, and without nearby care, the risks grow dangerously high. Democrats are seizing this moment to frame the issue as a fight for the survival of rural communities. They argue that Trump's legislation has created a ticking time bomb for healthcare access. Critics call it a short-term patch that will not stop the wave of closures ahead. Some Republicans counter by saying states like Virginia can dip into rainy day funds to cover gaps. But Democrats argue that state money cannot replace what has been stripped away at the federal level. As campaigns heat up, the debate over rural healthcare is quickly becoming one of the most politically explosive consequences of Trump's flagship legislation. Voters in small towns, who once strongly backed him, are now left to weigh whether these closures align with the promise to make America great again, or if they are being asked to pay the price. Before you go, don't forget to hit that subscribe button and join InsightPulse for more deep dives into the stories shaping our politics and communities. Stay informed, stay aware, and stay connected.